Hey, it's Dr. Wonder. Today I want to go over A1C and how it affects your risk for some of the complications. So the research tells us if your A1C is higher than 6.4, then your risk for the first two main complications of diabetes, which is heart attack and stroke, are increased by 80%, and your risk for Alzheimer's, which is actually type 3 diabetes, is increased by 65%. Now, everyone understands that because it's not really complex to understand if a number is higher than 6.4. Where it becomes an issue is if someone's number is less than 6.4, however, they're on blood sugar medication, they think that they're well controlled or doing better. And the fact of the matter is, if they weren't on that medication, would their A1C be higher? So let's use an example of Mr. Jones has an A1C of 6.1, but he's on 2 to 3 to 4, oral and or blood sugar medications and or insulin. Well, is his A1C really less than 6.4? The answer in the research tells us no, because if he wasn't on that, if he wasn't being bullied by the medication, then the A1C would actually be higher and he's still at risk. So keep that in mind, that are you really lower than 6.4 if you're on even one blood sugar medication? So this is not not an invitation or permission to stop taking or lowering any of your medications, but it's just a fact that if you're higher than 6.4 or you're lower, but you're on medication, your risk is greatly increased. Okay.